So, wow, do you have a red finger?
I do.
And it's extended up onto your hand there.
Yeah, this is just
wow.
It's spreading.
Within the I don't know, the last maybe like hour or two is starting to spread there, and this
Moving
is how
quickly.
it started off on Saturday.
Okay. Saturday. Were you out working outside? Or?
No,
Okay.
I was in my bed actually half asleep.
Mm-hmm. So
And
something stung or bit or whatever?
yeah, I felt something crawling in my shirt, and I stuck my hand back there, and then that's when I got the bite, and then so just Sunday kind of progressively.
And there's the Sunday picture. I'm glad you took these pictures.
Yeah,
that shows us how quickly. And then, of course, today is Monday now.
Yeah, and then so this morning it was I was just kind of comparing it next to my other finger, and the skin was all peely.
Yeah, look at that. Okay, so put your that's your left index finger. Now, are you able to bend your finger all right?
No.
You can't completely bend it already. Okay, so this almost looks like moving as rapidly as we might see with a cat bite. Remember, we've seen some of those. But obviously, you have either strep or staph, and my guess would be strep that's moving underneath the skin here very quickly. This is a very serious case of cellulitis. So we're going to be giving you 2 big shots, and we're going to put you on pills, and then we're going to see you back tomorrow. Okay?
Yep.
And if this is not reversed course overnight, then you'll be in the hospital tomorrow. That's how serious these can be, okay? All right, so I don't want to scare you. I'm not trying to frighten you. I'm just letting you know what to expect, okay?
She's just been through a lot.
Well, I imagine so. I mean, this looks like it really hurts. So give her something for pain too, please, ma'am. Okay. Are you allergic to any medicines? Okay, you're going to be okay. We're going to get you through this, I promise. So don't be scared. But obviously, this infection could get into the joint. That could make it more serious, right? The infection could start moving up the arm, and you could end up becoming septic. So it's very important that we take the antibiotics we're going to give you. And Johanna's going to give you a couple of shots, or her nurse will, I'm sure. And hopefully tomorrow when we see you, this is going to look a lot better. Go ahead and mark the borders, okay? So we're going to mark the border, so when you shower, don't scrub the markings off. We're going to mark along here so that we'll know
with
just
more
exactly.
Permanent pen?
With whatever. We can just use a ballpoint pen if you want. Just don't scrub it off, okay?
I can
There you go.
redo it if
there you go.
I see it fading.
Now, if overnight this is like going up your hand, I mean, and it's obviously is not getting better, don't wait. Go on to the emergency room and explain. And when they see those markings, they'll know how much it's moved, right?
Okay.
And they'll admit you and put you on IV antibiotics.
And she had a recent surgery.
Probably not related, but important to know, okay? So we'll get you taken care of, and we'll see you back tomorrow. Thanks for sharing your story with everybody, okay? Okay, bye. I want to see your happy finger now.
Yes,
Wow.
it's way better.
Isn't that great?
Yes.
And before you couldn't move it
and
very
then
well?
it shrunk as
Oh,
far
yeah.
as the...
That's what we wanted. That's what we expected. And that's why we don't always have, you know, when we see something like that, yeah, that was our emergency. Like if it gets to there, you go to the emergency room. I mean, it's really even hard to see that it's even still infected right now. And you can kind of see where that initial lesion probably was, a little punctum there of some sort. But yeah, you did great. That's fantastic. And it doesn't hurt as much?
No.
No, good. And you're moving it really well. Well, fantastic. We're just going to have to continue the antibiotics. I want you to go ahead and finish them, okay? And if you have any more trouble with this, you let me know. But you've responded so well to the medication that I'm going to tell you don't need to come back routinely, only if you think you're having a problem. Okay?
Okay.
Well, thanks for sharing your story with all our friends on YouTube. They're going to be happy to see that you did well. Because that really looked angry yesterday.
Yeah, it was pretty bad.
I expect that when people see that first video, they're going to say, why didn't you just send her? She should be in the hospital with that. And then they're going to see this one and how well you improved overnight. And they'll go, oh, maybe that wasn't necessary.
Yeah. Those shots worked.
Yeah. Okay. Good deal. Well, if you need us, we're here.
Awesome.
All right.
Hi guys, this is gonna be, stay tuned for the Meta 7 video.
Hey guys, this is Vanessa and I've been using Meta 7 for about a month now. It's really helped me since having a baby. I had a little bit postpartum, and I think after having it, after taking it, it made the wiring in my brain come back together. I feel like my old self and I have a lot of energy. I'm not wired up or anything. It feels natural, and I recommend this product to everyone. So get your bottle of Meta 7 today.
Hey guys, Dr. Gilmore here. Thanks for watching our videos. If you like pimple popping and you've always wanted to do your own pimple popping, we've got just what you need. Super Pimple Popping Kit has everything you need to get the job done right. The instructions for getting your own Super Pimple Popping Kit are in the video description box below. Thanks again for watching.